You're the greatest. You're the greatest, and so you deserve the greatest. And so it's a privilege for me to introduce our next speaker, who's going to introduce an extraordinary person. But Sally West Brooks has been my friend for over a quarter century. Quarter century later, I've got gray hair and I'm old and wrinkled. She's still beautiful. I can't quite figure all that out. But she was our third woman to ever chair the National Board of Directors. She is a volunteer extraordinaire, a dear friend, a wonderful person. Will you please welcome to the stage and give a warm relay and American Cancer welcome to Sally West Brooks, my friend.
Thank you. Bless you. Thank you.
I have 30 seconds. It is very special for me to introduce the next guest speaker, who has always been an incredible American Cancer Society supporter. And as a matter of fact, in about 1 week, on October 7th, we will celebrate our 49th wedding anniversary. Please give a warm American Cancer Society greeting to Dr. Marvin Brooks.
I'm so proud of my wife, who has been a volunteer with the American Cancer Society for over 40 years. And I have to tell you, I love her very much. Over the 40 years she's been with the Cancer Society, there have been tremendous advances in the evaluation and treatment of cancer. And what I want to do today is share with you some of the exciting information about the future of cancer care. And what's really exciting is that the future is here. One of the brightest new developments in cancer treatment is targeted cancer therapy, also called personalized cancer therapy. Personalized cancer therapy refers to cancer treatment tailored to a person's specific needs based upon genetic abnormalities found in their cancer cells. While this may sound complicated, each tumor is composed of distinctive genes, and certain cancer drugs have been found to attack these specific abnormal genes. Once physicians determine the genetic makeup of a cancer by analyzing the biopsy, they can match the patient's cancer to specific drugs depending upon the unique abnormalities. Such a breakthrough has been made for the treatment of some patients with lung cancer. Despite advances in detecting lung cancer with CT scan screening, and despite advances in chemotherapy, surgery, and radiation therapy, the death rate from lung cancer remains largely unchanged because in many cases the cancer has already spread at the time the diagnosis is made. Personalized cancer therapy is the direction of the future for the treatment of lung cancer, which has already spread. Historically, approximately 25 years ago, King Gustav of Sweden bestowed the Nobel Prize on biochemist Stanley Cohen for his discovery of the epidermal growth factor and its receptor. The epidermal growth factor is a small protein in the blood which is important for cell development and for wound healing, but it also can be involved in the development of cancer. In 1952, as a promising young scientist, Stanley Cohen was designated a postdoctoral fellow of the American Cancer Society in biologic research. In 1976, he was appointed an American Cancer Society research professor and in 1986, he was awarded the Nobel Prize. The American Cancer Society has a long history of funding promising young scientists early in their careers when it is difficult to obtain funding. Notably, 46 scientists funded by the American Cancer Society have gone on to become Nobel laureates. Clearly, the American Cancer Society is doing something right when it comes to recognizing those young scientists who have bold new ideas and who go on to produce some of the most significant research in the world that changes science and changes lives. When Stanley Cohen first identified the epidermal growth factor and its receptor, he had no way of realizing the full implications of the discovery. The epidermal growth factor receptor is found on many cells in the body, including lung cancer cells. In those lung cancer patients who have a genetic receptor abnormality, a targeted once-a-day pill called Tarceva, T-A-R-C-E-V-A, has been developed and often rescues patients from near death. They do not need chemotherapy, and they do not need radiation therapy. How do I know this? I know it because I have stage 4 lung cancer, and Tarceva has saved my life. I'm a urologist who spent 40 years practicing at the Eisenhower Medical Center in Rancho Mirage, California, near Palm Springs. Eisenhower is also one of the finest community hospitals in the country and is the home of the Betty Ford Center. And Betty Ford was a wonderful woman who also happened to be a patient of mine. I was one of 5 physicians on a planning committee to the hospital before it was ever built. In spite of the fact that I have never smoked, "15 months ago, while operating, I developed severe back pain. I thought the back pain was an exacerbation of the arthritis that I developed over the years of bending over an operating table. But that wasn't to be the case. In fact, I was found to have lung cancer in spite of never having smoked, and the lung cancer had spread to my back and to my liver. I saw Dr. David Vifai, an oncologist at the Eisenhower Medical Center with expertise in lung cancer. And he said to me, if I were you, I would get on a plane and go back to Yale for genetic testing. He knew that I had done my urology residency training at Yale. He went on to say that because I had never smoked, there was a possibility of about 10% that I would be a candidate for personalized cancer therapy with a pill called Tarceva. I have to admit, I had no idea what he was talking about. I could not believe that a pill could help me. And in fact, I thought that I would be dead within a year. Dr. Vifai went on to explain that the director of the Yale Cancer Center was Dr. Thomas Lynch, an expert in genetic testing and an expert in the personalized treatment of lung cancer, and that the director of oncology was Dr. Roy Herbst, an expert in the treatment of lung cancer. 1 week later, Sally and I were sitting in Dr. Herbst's office at the Yale Cancer Center. Now picture this. The next day, in the same hospital I used to operate in, and in the same hospital my wife was a nurse, and in the same hospital our son had been born 43 years previously, I had a liver biopsy which confirmed the diagnosis of cancer. We were told it would take about 10 days for the genetic testing to be done, so we returned to California to anxiously await the results. The phone call finally came, and we were told that I had a genetic mutation and that I was a candidate for Tarceva. I take 1 pill a day, have not had radiation therapy, and have not had surgery or chemotherapy. After 3 weeks, my back pain disappeared, and after 15 months, my cancer has been in total remission. And that's why you people are here today, because of the work you're doing to further what's going on in the treatment of cancer and cancer patients. You would think that after my having spent almost 50 years as a physician treating cancer patients, and after my wife spending over 40 years as a volunteer with the American Cancer Society, and serving as chair of the California division, and after serving as the 3rd woman in 95 years as national chair of the board, that we would have earned some type of divine dispensation from ever developing cancer. That's what I would have thought. But cancer doesn't work that way. Most of you are here today because cancer has touched your lives. Perhaps you have had cancer, or a relative, or a friend. Cancer does not discriminate. It's open to everyone. We're all here today as members of the American Cancer Society family. And as a family, let's keep moving forward. Let's finish what we've started, and let's cure cancer. From the bottom of my heart, I want to thank each of you for your dedication to the mission of the American Cancer Society. Because of you, I and millions of others will live to see another birthday. Thank you. Thank you.